Lucentis is only to be used in accordance with approved prescribing information. Please refer to the approved Lucentis prescribing information from your country of origin. Because Lucentis is administered by intravitreal injection, proper injection procedures must be followed during the preparation, injection, and post-injection procedures to optimize patient outcomes. Aseptic technique should be observed during injection tray assembly, anesthetic preparation, and Lucentis preparation and administration. Additionally, intravitreal injection guidelines, as outlined in the Lucentis country prescribing information, should be followed. To confirm proper pre-injection procedure, verify that the patient has applied an ophthalmic antimicrobial to the treated eye 4 times daily for 3 days prior to the injection. Additionally, the patient should have had their pupils dilated in preparation for the procedure. After antimicrobial treatment has been confirmed, the injection tray can be assembled. Remember, it is essential to observe aseptic techniques, which include the use of sterile gloves when assembling the tray and throughout the procedure. Assemble the proper supplies on the injection tray. These include a sterile eyelid speculum, syringes for applying iodine and saline, a sterile caliper, sterile cotton-tipped applicators, a sterile ophthalmic drape, cotton swabs and 4x4 sterile pads, saline solution, antimicrobial eye drops if desired, and povidone iodine. Next, remove the Lucentis from the refrigerator. The vial should be refrigerated until just prior to injection. It should never be frozen, exposed to direct sunlight, reused between patients, or used beyond its expiration date. Included in the Lucentis injection kit are the single-use Lucentis vial, a 1 ml syringe, an 18-gauge blunt filter needle identified by a purple hub, and a 30-gauge injection needle identified by a yellow hub. Lucentis should be inspected visually for particulate matter and discoloration prior to administration. Remove the cap from the vial and disinfect the stopper with isopropyl alcohol. Attach the blunt needle to the syringe. Next, carefully remove the cap from the blunt filter needle without disconnecting the blunt filter from the syringe. Then, push the needle down into the center of the vial stopper while holding the vial upright and withdraw all of the Lucentis from the vial. Leave the blunt filter needle in the vial and disconnect the syringe from the blunt filter needle. Aseptically and firmly attach the injection needle to the syringe. Carefully expel the air from the syringe and adjust the dose to the 0.05 ml mark. Do not wipe the injection needle and do not pull back on the plunger. Carefully remove the cap from the 30-gauge injection needle without disconnecting the injection needle from the syringe. The syringe is now ready for injection. The patient should be prepared for injection by applying anesthesia and antimicrobial eye drops. Next, disinfect the periocular skin and eyelids of the affected eye. Swab the eyelids and skin surrounding the eye with 10% povidone iodine swabs. Start with the eyelids and continue with the surrounding skin, proceeding from medial to temporal aspects, making sure the eyelid margins and eyelashes are swabbed. After disinfecting the eye area, put a sterile ophthalmic drape over the affected eye Then, apply the sterile eyelid speculum underneath the eyelids. Wash the eye with 5% povidone iodine ophthalmic solution, making sure to cover the conjunctiva over the planned injection site. Then wait 90 seconds and wash with saline solution to remove the iodine. Now the eye is prepared for the injection of Lucentis. Direct the patient to look away from the syringe prior to giving the injection. Use the sterile eye caliper to carefully measure the scleral injection site 3.5 to 4.0 mm from the limbus. Insert the needle through the pre-anesthetized conjunctiva and aiming towards the center of the globe. Deliver the injection volume slowly and remove the needle slowly to ensure all of the drug is in the eye. For subsequent IVT injections, you should rotate the injection site. Now the injection procedure is complete. Post-injection, be sure to dispose of injection materials properly. Immediately evaluate light perception, indirect ophthalmoscope findings and intraocular pressure. Finally, instruct the patient to administer antimicrobial eye drops 4 times daily for 3 days after treatment. The following is a brief review of the injection procedure. Aseptic technique should be observed during the entire procedure. Assemble the proper supplies on the injection tray. Prepare the Lucentis injection kit. Prepare the affected eye for the injection. Direct the patient to look away from the syringe and inject the Lucentis aiming towards the center of the globe. Immediately evaluate light perception, indirect ophthalmoscope findings and intraocular pressure. We trust that you have found this video useful for learning the proper procedures of treating your patients with Lucentis. It should be a valuable tool to minimize the potential injection-related adverse events.